Hi YouTube, it's Jen. I am here on my 4th day of my pre-op diet. Today is Tuesday, June 17th, and I am having surgery on June 19th. And so I'm on a 5-day clear liquid diet, which I have been doing a full liquid diet because I didn't want to I didn't want to be hungry. So, the first 3 days were really hard. Yesterday, I almost had a sub sandwich, but I just kept taking liquids, and I had soup, and I made some veggie juice. So I think that helped a lot. So I've been able to stick to liquids, not clear, but full, and I think that's great for me. Of course, follow your own doctor's recommendations. But sometimes I think, at least for my doctor, he doesn't individualize, is what I've noticed. So I'm going to follow the outline of his plan the best I can, but I'm also going to take into account that I am an educated, intelligent woman. I've done my research. I've researched lots of other physicians' plans. I've read, I've talked to people, and I think for myself, I have a good food plan set in place for after surgery. So, of course, I'm not a physician, so follow your doctor's instructions, but what can I say? I'm a rebel. I'm a bariatric rebel. I guess what I am my plan to follow after surgery is, there's a physician from Michigan. His name's Dr. Matthew Weiner, and he has a book called A Pound of Cure, but on one of his videos, he talked about his bariatric diet for his patients, and I really, really liked how he laid it out, and it's, I'm going to combine that with mine and see how it goes. I have to listen to my sleeve, right? I have to see what it can tolerate and things like that. So, but I feel for me it's really important that I incorporate the vegetables and things like that early in a pureed or blended form, because it makes me feel better. I've eaten crap for so long and I'm malnourished. I am 280 pounds and I am malnourished because of all the crap that I eat. So, and that's really sad. So, anyway, that's my goal. I'm totally rambling here, but I have a little list I want to follow. So it's my 4th day, pre-op, and I'm doing good. I feel like today and tomorrow feels different. I feel like maybe there was a hump I got over as far as being hungry. I think I'm going to be fine with my protein drinks until Thursday. So as of right now, I am not planning any kind of Last Supper. I want my liver to be nice and small for them. I don't want it to get nicked in surgery, because that is a whole bad news if that happens. So, yeah. Let's see. So what am I going to bring to the hospital? I think from what I'm going to bring is I'm going to bring my iPad, a charger, Gas X strips. Ugh. Do I want to bring slippers and walk on the nasty floor you know what, maybe I'll just wear the socks that they give you. Did anybody take those socks home? And if so, you know what I'm talking about, the hospital socks. Do you wear them? Because I feel like I see people wearing them a lot. I work in a hospital, and I feel like I see patients who come in for outpatient, and then they're wearing these socks. It's kind of funny. So, you know who you are out there. I'll probably be one too. I'll be wearing them at home. What else? gastric strips, something comfortable. I'm going to wear a big comfortable dress there and back. And maybe a pair of, like a pajama gown or something like that, so I can walk around the halls. Other than that, I don't know if anybody has any recommendations. It's just an overnight stay, so, and I have books and stuff on my iPad. So anyway, hope maybe I'll just rest. So as far as surgery, why am I having surgery? I'm having surgery because I'm tired of being fat. I'm tired of struggling. I'm tired of losing the same 50, 60, 70, 80, 90 pounds over and over again. I'm tired of feeling like a failure. I'm just tired. And, I've had a weight problem since I was 10. I started Weight Watchers when I was 10, and I'm 42. So, I really need this tool. I think this tool is going to change my life. In that it's going to help me achieve what I want to achieve, which is health. And I want to be able to have activity. I want to be able to have energy to play with my kids. Right now we're at a water park. We're leaving in about an hour. My kids are inside with my husband, and I'm out here making a video because I just don't have the energy to be in. I just don't have the energy to do it. So the next time we'll be here is in November, so I'm sure that'll be a different story. So I want to feel better. I want more energy. I know that losing weight will help my self-esteem and my confidence. And I want to look better. I mean, I know that I'm going to have lots of shrinkles. I know that there's going to be a skin issue. That's not so, I can deal with that. That's fine. But I know that I'll look better. I'll feel better. I'll be able to buy clothes that, fit me and that I look good in. And so there's that part of it, but it's really, I just feel like crap. So I want to feel better. I want to feel good. So what are my hopes? Well, one thing I really hope for, or it's a goal of mine, is to get rid of the diet mentality. And that's something that's going to take years. I mean, years. So it's not something that I expect is going to change overnight, or even in a year. It's going to take a long time. But that's what I'm working on, and I feel like having the surgery is going to help me with that. I don't know. I guess time will tell. But that is something that's really, really important to me, because I don't want to be, I don't want to be 50, 60, 70 and saying, oh, I wish I looked like so-and-so, or, oh, why can't I eat like so-and-so, or, oh, I want to be happy with myself. I want to be content. I want to be thankful for what I have, and what I want to have is a healthy relationship with food, a healthy relationship with my body. I mean, that's what I've been working on for the past few years anyway, so this is just, I guess, a part of the journey, is this surgery. Man, I have terrible handwriting. Look at eating. Oh, I think that, too, and I know that this is going to happen, having the surgery, I'm going to have to deal with my eating disorder in a different way. So I have binge eating disorder, disordered eating, and I've been working on that for a while with a therapist. And, not being able to eat, to stuff down my feelings, or to numb myself, or to eat for stress, or to eat because I'm happy, or to eat because I'm bored, or I'm not going to be able to do that. And, I think that's really going to push my recovery or my therapy to places that I can't go right now because I still, can use food. And I know that I'll be able to, I know that I'll be able to use food, in the future. But at least here in the beginning stages, while I develop the healthy eating habits, while I develop, while I develop the good habits, and I'm feeling better, I'm hoping that, with therapy, I don't know, have a breakthrough or something, or I'll actually have to learn the things. I'll have to use the things that I've learned in therapy. So we'll see. That'll be a in vivo experiment. What else? Okay, my plan. This is my plan for surgery. No, for after surgery. As far as measuring progress. So I have a problem with the scale. To me, getting on a scale multiple times a day, or after going to the bathroom, or with clothes, without clothes, after eating, whatever the case may be. I've done it all. I've let my life, how I feel about myself be controlled by a number, and it's ridiculous because it could say, if it said 282 pounds and I wanted it to say 281, that could ruin my day. And it has. So, probably about 2 years ago, I got rid of my scale. And the only scale I have in my house is our Wii console, the foot console. And my poor little Wii person is so fat. She's so fat. And I think what I'm going to do is maybe in a year, I'll get back on it and just shock the crap out of it. And watch my Wii guy, lady, whatever they're called, just kind of shrink. I think that'll be fun. I'll do that on my 1 year anniversary. So the scale. I don't have a scale at home. I'm not going to weigh at home. There is a scale at work. Right now I work 3 days a week. So I think what I'm going to do is just pick a day and weigh that day. Or I don't think I can wait for doctor's appointments. So I think I'll probably weigh once a week. And measurements. I'm going to take measurements. I think that'll be a really good measure of progress. But as far as like my goal, my weight goal, my body's changed so much since I've had kids, so I don't know what it's going to look like at different weights. My goal is to be able to be between a size 10 and a size 12. I was in a size 10 for about a day, maybe like 4 or 5 years ago. So, a 10 would be like, woo! I think for me right now is like that would be like the ultimate. But I would like to be in a 11, 12. That's my goal. So whatever weight that is, probably thinking it'll be like in the 160s, 170s, maybe. Probably the 160s. So, that's where I'm hoping to be as far as weight-wise. And then I think I already talked about post-op diet. I'm going to be a rebel and have my doctor's plan in front of me. Again, he doesn't individualize. He had a patient that had a leak once. And so after that, he put everybody on the same diet. And it's 4 weeks of a liquid diet. So I'm going to keep that in the back of my mind. And I'm also going to follow another plan that I talked about. And I'm going to keep in touch with my nutritionist too. And maybe I can work with my nutritionist and we can work to change the doctor's mind. But I don't, you know how they are. You know how those physicians are. Some of them are just not, they're surgeons, So anyway, oh boy, that's pretty long. So I hope everyone's doing good. I'm feeling really good, feeling great. Surgery in a day and a half. Very excited. And thank you for all your support, everybody. Oh my gosh, this community is awesome. And that's it. I'll come back in. I don't know. Maybe I'll come back in after I get my drugs on Thursday after I have surgery and check in. Okay, take care. Bye.